I'm here to do video validation for sterile dressing change. I would come into the room and I would introduce myself to the patient, tell them what I'm here for. I would identify them by their name band and have them repeat their name and date of birth back to me. If they were in any pain, I would pre-medicate them and come back in 20 to 30 minutes. If they were ready, I would wash my hands and pull back the covers. I would loosen the tape. Then I would put on my clean gloves. I would take off the dressing and note the type, the amount, the color, the odor. Put it in the biohazard bag. Then I would check to see if there was any redness around the wound, any necrosis, or any drainage of any kind. Take my gloves off, and I would wash my hands. Now I'm going to measure the wound, and because I'm not going to touch the wound, I don't have to have the gloves on. I would measure the length and the width without touching the wound. And then I would take my cotton tip applicator and I would measure the depth of the wound. I would use my measuring tool to measure that. Then I would throw that away. Now I can take my culture, but I'd wash my hands first. I can open the culture with sterile technique. Then I would get the culture, put that in there, and then I would put the name, the room number, their date of birth, and where the wound was located, and then I would put it in a biohazard bag and I'd send it down to lab. Now I'm ready to get my stuff ready for the sterile dressing change. I'd wash my hands and I would take an alcohol pad and I would wipe off the table, and then I'd wait for it to dry. And now I can open my supplies. Okay, now I would wash my hands. I would put my sterile gloves. Now I'm going to put my sterile gloves on after I've washed my hands. Okay, now I'm going to pack my wound. And I put on my 4x4. Now I'm going to put on my ADD fold. I'm going to take off my gloves. I'm going to wash my hands. And I'm going to put the tape on. I'd make sure my patient's in a comfortable position and ask them if they're in any pain. Then I would document any findings I had, any arrhythmia or anything like that. I would clean up my mess, and then I would go in church.